Hello yogis! Welcome to a video on a few yogic breathing techniques. In class, we might practice one or two of these techniques. This video was created to see all the techniques we practice in one place and maybe give you some confidence in doing these techniques on your own. If anything makes you feel faint or dizzy or agitated, please let your breathing return to normal and consider following this video at another time. This is a collection of mostly gentle breathing patterns, but sometimes even gentle is too much. First, maybe you should blow your nose. I'm going to give you a few moments to find a Kleenex and go ahead and clean out your nasal cavity as best you can. And we will begin on the back for a little centering. For most of this time, even though I'm asking you to be on your back, I'm going to stay seated because I think my voice carries better if I'm up in a seated position. So we'll begin on the back with a little centering, followed by the first breathing technique. But please have two blocks nearby. I have one on my left and one on my right. And if you don't have blocks, pillows will work just fine. You might also be a little bit more comfortable with a pillow or a pillow blanket, as I like to call them, underneath your head. So go ahead and let yourself down onto your back body. If you have an extra blanket, you might use that over your body or maybe rest it on your belly. And once you arrive, notice how the back body is meeting the floor. Maybe there's an awareness of how the temperature of the body is warming the floor beneath you. Notice the ease of the flow of the breath. You might allow the eyelids to close so that the sense perceptions are brought inward. Is there any tingling sensation or even a vibration of the lips? Does the area around the throat feel open and free? Is there a sense that the collarbones move away from each other slightly on each inhale and retract back toward the midline on each exhale? We'll start by elongating the breath to a count of 4 on the inhale and the same length on the exhale. Long, slow, steady breathing. Keep the rhythm soft and easy. Go ahead and release tension from your facial structure and your jaw. Relax where you can. You might notice that it's possible to introduce a slight pause at the top of the inhale and a slight pause at the bottom of the exhale. And if the eyes are closed, go ahead and blink your eyes open. That helps get some moisture on the eyeballs. And I'm going to demonstrate on the back body how to use the props. You can see that I'm using blocks, and I bring them in close enough to the torso that the backs of my arms near the elbow and the back of the humerus bone can rest on top of my props, so that one hand is on the belly and the other hand is on the upper chest. The hands are there to witness the movement of the body that follows the breath. So we'll start by doing a little belly breathing, and that means that we're going to expand the belly on the inhale and let it release back on the exhale. And this is a very soft, slow movement of the body. We're not trying to blow it up like a balloon. We're just noticing a little bit of rise of on the inhale, and then that falling back on the exhale. And do this a few times to help settle down your thoughts, settle down the emotions, and feel this energy of going inside, this being in touch with yourself. And just like we practiced with the first technique, you may be able to have a slight pause at the top of the inhale, and again a pause at the bottom and the depth of the exhale. And let's let that go and move the breath to the upper part of the chest. So now on the inhale, we're seeing if the hand that's on the chest can rise up a little bit toward the ceiling and release back on the exhale. And repeat that action a few times. And there's no rush here. Take your time. Let the body have that full and complete volume of air coming in, and then also the complete exhale, making sure that you're really letting go of the oxygen and the other air that's in your lungs back out on the exhale. And there is a little bit of oxygen that still comes out on the exhale. We don't take it all in on the inhale. And let's let that action go and let your breath return to normal. And next, I'm going to cue for alternating between belly breath and chest breath. If you prefer doing one or the other, this is your practice, so go ahead and do what suits you best. But I'm going to expand the belly on the inhale, let it release on the exhale, and then switch to the chest. Inhaling with a big expansive chest and then letting that settle back and then going back to the belly. So slowly alternating between the two. There should be no push or pull or strain. If you need to go back to just your regular breath a few times, that's fine too. Let's let that breathing technique go and let the breath return to its unconscious pattern. If the props are comfortable, you can leave them there, but if they're calling your attention too much or you feel like they're setting up some level of agitation, certainly take them away. For the next few moments, notice where the breath is entering the nostrils. Perhaps there's a slight flaring of the entrance of the nostril on the inhale. There may be a cooling sensation as the air enters your body. As the inhale continues, the air is warmed and moistened in the sinuses to keep those tissues from drying out. Go ahead and follow that inhale sensation into the area, down the back of the throat, and past the larynx, and through the windpipe. This air then fills the lungs by inflating the soft, spongy tissues in both lobes of the lungs, located in the mid and upper chest. Notice the slight transition when the air reverses direction and it begins exiting through the same pathway and the lungs deflate. Eventually, warmer, moist air is exhaled through both nostrils. Does the flow of air seem to be even in both of your nostrils? Or is one side allowing for greater flow of air? Just take a few moments to notice what's happening there. And you can go ahead and blink your eyes a few times. And maybe you'll draw your knees in toward the chest so you can cross the feet at the ankles and rock yourself up to a seated position, or roll over onto one side to come up to a seated position. Next, we're going to bring the hands, oh, and by the way, of course you can be seated in a chair at this point if you're more comfortable on the chair than on the floor. Next, we're going to bring the heels of our hands, the very base of the palm of the hand, to either side of the body. So you might be able to feel the seam of your shirt on the right side and left side here. The elbows are drawn back. And we're going to take a few breaths here and allow the hands once again to witness the movement of air coming into the lungs. As the air comes into the lungs, the rib cage is opened. And I'm going to try to do this out to the sides instead of thinking that everything always comes forward. It certainly did when we were on the back because that was really the place for it to go. It couldn't go behind, even though 2/3 of the lungs are actually behind the seam of your shirt. So here we go. Big exhale and a big inhale. And you can see my hands are drawing apart from one another on that inhale and then retreating back on the exhale. And we'll do that a few times. Inhaling and slow exhale. And 2 more times. Inhaling and exhaling. And you might even think of the air coming in 360 degrees in the lungs. And let that go. And go ahead and rest the hands on your lap or on your knees. You might close your eyes here and just follow that easy pattern of breath. We're just allowing the breath to return to that normal kind of unconscious breathing. I know many of you have, and now we can let that go too. I know that many of you have yogic blocks. And next we're doing Nadi shodhana. And I rest one block on my lap, the other block on the high side, and my elbow on top. If you don't have these blocks, it's possible to have one hand across and supported this way. I really prefer that there's a different way for you to support your 2 longest fingers on your forehead, because any of that holding brings in a bit of tension to the body. So 2 blocks stacked up. Sorry, I've got two blocks that kind of match my shirt, but you get the idea here. Elbow on top. And as that finds its structure. My two longest fingers go on the third eye, right in the center of the forehead. So the thumb is free to be on the left side. I'm using my right hand. And my index finger is on the right side of my nostril. And we're going to start by closing off the right side of the nostril so we can inhale left, close left with the thumb, exhale right. Inhale on the right nostril, close the nostril with the ring finger, remove the thumb, exhale left. Inhale left, close left, exhale right. Inhale right, close right, exhale left. And go ahead with that pattern a few more times on your own. Sitting up straight and tall, crown of the head reaching for the ceiling. And the next time you exhale left, you can take your hand away, take the blocks away, and sit with your hands on your lap or on your legs to feel for the after effect of that breathing technique, Nadi shodhana. Notice if both of your nostrils might feel a little bit more open, or if that's not true for you, which side is more open. Again, we'll open the eyes with a few blinks, take the arms out to the sides, palms face up. Inhale as the arms come up overhead, turn the palms away, and exhale as the arms release back down to your sides. Two more times. Inhale, arms up. Exhale as they come down. And one last time, inhaling the arms up, and this time palms together, and release the hands down to heart center. And next we're doing the Bumblebee breath. We don't do this very often in class. You can either choose to use your fingers on your face, or perhaps you just do the Bumblebee breath without using the hands. Those of us wearing glasses will set the glasses aside, and we're taking our three longest fingers to gently place over the eyes. Sometimes I just put my index finger on my eyebrow, and then the fingers are there kind of covering the eyes but not really touching the eyes. The thumbs go back to that little flap of skin over the ears, so that you can press on that, having that feeling of turning out any kind of sound that's coming. Of course, you don't want to totally do that, you won't be able to hear me, but just at that suggestion of a little bit less sound, and certainly the suggestion with the eyes closed that we're bringing our senses inside. As we bring in a deep inhale, follow that with a humming sound on the exhale. And when you're out of air, there's an inhale, followed by the humming sound on the exhale. And one more time. Deep inhale and long humming exhale. that is the Bumblebee breath. I have to put my glasses back on so I can read my notes. Okay. Next we'll go to Ujjayi breath. Now that we've done the humming, you've felt that vibration in the vocal cords, and that will happen again in Ujjayi breath, but without the humming. Ujjayi breath is sometimes called the victorious breath. So again, think about that humming activity and what had to happen for you to create that hum. Have a bit of an inhale, and then act as if you were going to hum, but just before that sound actually starts, so that somebody sitting next to you could hear, there's a little vibration that happens, and you might hear it in your ears. And have the exhale happen, but keep the hum from occurring. And then, of course, there's got to be a big inhale to try again. And one more time, inhale. And that exhale that just coats your vocal cords with air. Ujjayi breath can also be done on the inhale, but it's a little bit more tricky. But go ahead and give it a try and see if you can make it happen. Sometimes this is also called the ocean breath. Because we're bringing in a very large volume of air, you might start to feel a little bit dizzy. And if that happens, you have a couple of choices. Of course, the easy, obvious one is to just stop doing the technique and let your breath return to normal. The other is to really slow down the breath and perhaps introduce another pause at the top of the inhale and perhaps a pause at the bottom of the exhale. Our last breathing technique is the Om chant. And some people don't really refer to this as a breathing technique, but it does change our breath, and therefore I put it in that category. In many yoga classes, Om is taught as just the O and the sound. But today we're going to be practicing it as I was taught it by Debbie Cohen a long time ago. O, ah, and And the louder you make these sounds, the more you are treating your body like a musical instrument, and you'll get much more vibration into the body that way, which is kind of the whole point, or at least one of the points. So again, it requires a full and complete exhale, so you can have that big inhale. So we have that big and complete full exhale, followed by the inhale. I hope you've learned a little bit about breathing techniques, and And perhaps you'll try the video a few more times to see if you can get more comfortable or more experienced at doing these techniques. Thank you very much for joining the class.